Hi, I'm Dr. Tanvir Reza, and I've been treating sleep apnea for the last 20 years. More than 50 years ago, we did not know what diabetes was. More than 100 years ago, we did not know what blood pressure is. Now we know how dangerous both can be. Now there is a new disease, a new kid in the block called obstructive sleep apnea. What happens? People snore at night, they stop breathing at night, the oxygen falls. This happens because the upper airway collapses and completely blocks your breathing. Commonest symptoms: poor sleep, tiredness during the day, falling asleep during the day, even if you're in a meeting or if you're driving or even if you are riding a mobike. What happens? Because the oxygen goes down, blood pressure shoots up, heart rate shoots up, and there is a tremendous stress throughout the body from head to toe. That leads to high blood pressure, to heart attack, to worsening diabetes, to stroke. And at night, in extreme cases, we can have sudden cardiac death because of cardiac arrhythmias. How do you diagnose it? Before diagnosing, you have to suspect it. So if you are a snorer, especially if you are overweight, if you have these risk factors like hypertension, diabetes, etc., see your doctor, a sleep specialist. Emoha Elder Care will handhold you and guide you to the right specialist. Once the doctor suspects that you have sleep apnea, he will ask you to do a very simple overnight test called a sleep study. Sleep study tells you whether you have sleep apnea or not. Once you have been diagnosed with sleep apnea, treatment is very simple. Emoha is there to always look after you and your parents, especially the elderly, where the incidence of sleep apnea is much higher.